Hey guys, it's the deepest hell here, coming to you from the hot tub today. I was just going to let you know that I've been working on a script for a long time, and it's an important one, and I wanted to make sure I got it right. I'm going to talk about social determinants of health. And if you want something to bring doctors down just a notch, like if you think they might have big heads and they need to get adjusted just a little bit, this is one of them. This will humble some of the doctors out there. It's called Social Determinants of Health. Like I said, this one is really important. So let's start with a definition. What is a social determinant of health? Social determinants of health are the non medical environmental conditions in which people are born, grow, live, work, and age that significantly influence their health outcomes, their quality of life, and the risks that they face. They are the key drivers of health outcomes and include factors like economic stability, education, safe housing, transportation, and social setting. What does all that mean? It means that there are many factors that impact your individual health outcomes. One of the obvious factors is access to quality health care in terms of location, cost, technology, and clinical competence, clinical judgment. These have always been kind of traditionally the ways we evaluate healthcare. In the past, the Affordable Care Act, ACA, or Obamacare, called for something called the triple aim of healthcare improvement, and that consisted of improving healthcare quality in terms of outcomes or metrics, things we could actually measure and compare and graph and report. The second thing was improving the patient experience, and the third thing was reducing cost. Eventually, once they actually had clinicians become involved in the process, it was then deemed the quadruple aim, which included the additional caveat of healthcare provider job satisfaction. And what can be said about the job satisfaction level for the healthcare industry? Well, there's a lot of preparation that goes into a healthcare career. Sometimes training lasts several years that you're making sacrifices and perhaps getting behind and into debt financially. There are tons of government regulations, and then there's hoops that the insurance company makes you jump through. We call them hoops because every year there's more and more regulations placed on us. And then there's the internet, there's misinformation. There's the patient's yoga teacher who's telling them something that the healthcare professional isn't. There's the fact that we have to deal with the healthcare insurance industry, which may or may not pay for the things we prescribe or the ideas that we have. Enter the social determinants of health. You see, much to the doctor's chagrin, the impact that their expert care has on the lives of their patients is negligible when taken in the context of all the factors that affect the final outcome. Social determinants of health are the big impact that follows the tiny piece of the pie that is represented by the care provided in the exam room by the clinician. So you could have the absolute best clinical judgment by a healthcare provider go completely adrift if the social determinants are not aligned and supportive. So what are those social determinants of health? Well, they're things like access to transportation, legal support when needed, nutrition. You've probably heard of food deserts. Certain places you just don't really have good access to food and nutrition. Employment, social support, the actual environment, the environment that we live in, education, access to education, technology and internet access. All of those are really important. And here at the deepest hell, we also advocate for one thing that is commonly left off the list. It's left off the CDC list. All the research entities, they don't really mention it, but there is a really important one that tends to be missing. I wonder if you know what it might be. I Googled a list of social determinants of health, and what did I get? I got all those main ones, and they came up again and again in research papers, but it seemed like there was something missing. Maybe there was one thing that kind of, sort of, in a way, had an impact on the care we provide every day, even every moment to moment aspect of our patient's life. What could it be? Then I Googled, is religion a social determinant of health? And it came up right away. Yes, religion is a prominent social determinant of health. Why do you suppose it hasn't been featured on the list of common social determinants? I think this is a microcosm of how religion gets a free pass from scrutiny. Not only would religion potentially impact patients and their families in a very positive way, but there are negative impacts of religion on health. And that's one of the purposes of my channel. Here at The Deepest Hell, I like to show how medical research suggests that childhood religious trauma impacts health across a lifetime in an extremely negative way. So hashtag free pass alert. Once again, we get religion flying under the radar to avoid scrutiny. Remember, kids are not just little adults, but adults are just grown up, sometimes traumatized kids. Thanks for watching.